So, dear friends, meeting after a very long time because of many reasons. In between, there were holidays, then there were a lot of work was there with me, and that's why it was not possible to meet all of you. And uh, in fact, I have missed many things while discussing with you. So there is a big gap before the summer vacation. We have started with discussing the disease classification from H.A.Robert. We have discussed psoric miasm in detail from Robert. All four chapters devoted to the Sora. So the first disease classification Sora, then Sora continued, then the Sora or deficiency, then some manifestations of latent Sora. All those things which we have discussed in detail over there. Thereafter, one more chapter from the syphilitic miasm, the syphilitic stigma we have discussed in detail. This syphilitic stigma is again one has to understand and compare it with the Psoro-Syphilitic conditions, and that's why he has written one more chapter. There are three chapters totally devoted to the syphilitic miasm. For Sora, they were four. For syphilitic miasm, they are three, and for psychotic miasm, they are three again. So today we're going to start chapter number 27 from the H.A. Roberts philosophy, the disease classification, the syphilitic stigma continued. We'll discuss sentence by sentence because this is the miasm one has to understand very clearly. And this has a lot of meaning. We will get answer to many questions in our mind. Why such types of disorders all of a sudden develops in human being, how they get transformed. Every aspect was explained by H.A.Robert in this chapter. So let us open chapter number 27, the disease classification, the syphilitic stigma continued. It has been said that the patient afflicted with syphilitic taint suffers from structural changes. Underline these structural changes. This is very important, which is not there with Sora. First differentiating factor, Sora has a functional manifestation. Syphilitic and psychotic has a structural changes. 8. The emotional sphere in purely syphilitic patient is not seriously affected. There are no emotional symptoms like a Sora miasm. Sora, we have ample eruptions. The anger is there, the irritability is there, the sadness is there, then excessive joy is there. A number of things, of emotions which are reflected because those are functional. Syphilis, we don't get that. The mind is syphilitic where either it tries to destruct himself, either it tries to destruct others. It is it is in fact a structural mind change. It is a pathological. So where destruction develops in the mind is a structural mind change, or which is called to be a very specifically pathological mind. It is not simple emotional. Yet the emotional sphere in purely syphilitic patient is not seriously affected. For this reason, in syphilitic patients, we find less subjective symptoms. He has clearly mentioned over there, we get many more structural changes. We get directly a pathology. We get that there is a liver cirrhosis without any emotional sphere over there. We get a heart problem. The coronaries gets obstructed and there is a myocardial infarction. There is a splenic infarction. There is a kidney failure. There is a gangrene. All structural manifestations where you don't get a functional emotional sphere more, you get directly over there a structural change. That's why we never get the subjective symptoms more common. There is little of the supersensitiveness and less desires, cravings, longings than the psoric patient. In Sora, we have discussed that there are many desires. They crave these, that, everything. They averse many things. So there are a lot of differences are there because Sora is very active. It is the functional state of the mind because of which patient craves a lot in psoric miasm, which is not there with syphilitic. And that's why there are limited desires, limited aversions, which are reflected in psychotic as well as syphilitic stigma. The syphilitic patient actually suffers much less than the psoric. What it means? We never understand the meaning of this sentence. Many times, how can it be? Why he is saying like that? syphilitic patient much less suffer than psoric patient. Means pain is not an important factor over there, which is much more marked in psora. Psora, n number of pains are there, and because of which patient is struggling for pain. Here the pain is not there. Here the directly pathology is there. You get a patient directly with ascites. What symptoms he is having? Just discomfort in the abdomen. But he's not complaining, doctor, I'm having pain, and you treat that and aggravated by that and ameliorated by this. Don't get symptoms over there. You get directly a pathology in syphilitic myasm. No functional symptoms or very less functional symptoms. So meaning of this sentence is that syphilitic patient actually suffers much less than the psoric. So suffering is not there. Suffering from pain is not there. It is the directly structural suffering. The mental sphere has not been so much invaded, for the syphilitic stigma is not so thoroughly established through the untold centuries of time as the psoric. And because it is not so thoroughly a part of very essence of man's spirit, we have far better chance to eradicate the dyscrasia. Second important thing, the emotional sphere never gets so involved, or if it is involved, it is directly a destruction of inner mind, destruction of the human will. So patient comes to you and he's in absolute depressed state and he wants to suicide. Doesn't want to live. He doesn't want to do anything. Absolute indifference in the life. This is the sphere which you can get. But you don't get symptoms, n number of symptoms, mental symptoms, which you commonly get over the psoric patient. So there is no restlessness, there is no irritability, there is no anger, which you used to get very commonly with psora. These are very functional. If anger is there, anger is so extreme that he will directly kill the others or he will directly kill himself. So, at the emotional sphere, you never get such symptoms as we used to get in psoric patient. So, we can easily catch out this is a venereal miasm or this is non-venereal. Non-venereal, n number of functional symptoms. Venereal, there are very, very less functional symptoms. So this first paragraph only, he has directly explained the difference between the two miasms, the psora on one side, the totally functional, syphilis is another side, structural changes. So these things one has to understand very clearly. The very earmarks, what he has said in that paragraph, because it is not so thoroughly part of very essence of man's spirit, we have far better chance to eradicate the dyscrasia. In Sora, it is very simple because in Sora, all things are functional more commonly. In syphilitic, structural changes are there. And that's why you cannot directly make a change at the structural level. The pathology is already advanced. There are less chances of going towards the normality. The very earmarks of the various stigma show their respective characters. Earmarks means specific manifestations. Earmarks means characteristics. See the earmarks of Sora. The psoric itches and appears unclean, unwashed. Sora miasm, you immediately find it out. There is a lot of itching. The patient likes to be unwashed. Is unclean, scratching all over the body. Very simple earmark of Sora. The syphilitic ulcerates and bony structure is changed. So write down one by one. Sora, itches, unclean, unwashed. Syphilis, ulcerates, and bony structure is involved. So you can differentiate where the pathology you will going to find it out in these miasms. The third one, the psychotic infiltrates. What is saying? Infiltrates, deposition, growth, addition, hypertrophy. So psychotic infiltrates and corrodes by its discharges. So there is infiltration followed by discharge, which is corroding the part. It is affecting the part. It corrodes as if it burns the parts. Discharge is so strong in case of psychosis. See, three earmarks of three different miasms, and very easily you can locate Sora itches, unclean, unwashed, syphilis ulcerates, and there is bony structure affected, And psychotic, there is infiltration, producing a discharge which is corroding the parts. Very easy to recognize. Psora is the stigma which shows little on the side of objective symptoms, but expresses itself through the mental and emotional reactions. Here he compares Psora with syphilis. Psora, you have many emotional symptoms, many functional symptoms, but no structural change. Whatever structural change is there, it is so simple, acute inflammatory. It is just a simple inflammation. You're not going to get the pathologies like syphilitic or psychotic miasm over there. For this reason, patient of a tubercular diathesis means Psora plus syphilis. For this reason, the patient of a tubercular diathesis reflects many subjective symptoms in comparison with purely syphilitic, as has been pointed out before. The tubercular is a combination of psoric and syphilitic. Tubercular miasm is a combination of two different miasms, Psora plus syphilis. That's why it has structural changes at the same time the functional manifestations of Psora. So if a patient is having any pathology along with lot of pain, lot of modalities, consider this is typically a tubercular miasm. If it is just a structural without any emotional functional symptoms, then definitely it is not sorry, it is syphilitic. But when combination of these two happens, you're going to get the pathologies associated with the psoric functional symptoms, and that's why patient suffers along with the structural changes in tubercular miasm. See, here you get the comparison everywhere. In this chapter, the comparison between Psoro-Syphilitic and syphilitic miasm he has given everywhere, and that's what we have to understand. In this combination, we find all mental and emotional reactions. The subjective symptoms of the predominant parent, Psora, and the pathological and destructive changes of the younger parent, syphilis. So, see, very easily he has mentioned, it is a combination of two different miasms. Tubercular miasm is combination of Psora and syphilis. So, psoric functional emotional symptoms, all of them are present dominating along with the structural changes of the syphilitic miasm. So if one is able to understand this concept clearly, then he will immediately come, yes, this patient is tubercular because he has pathology along with a lot of manifestation. Specifically, I will give the example, the ars iodide. You're going to get the pathologies in ars iodide. The asthma is there, the bronchitis is there, associated with lot of functional symptoms. The patient is having all typical features of arsenic also. The patient is restless, patient is absolutely in anxious phase. Patient is having lot of symptoms also. The patient's complaints gets aggravated at night. So pathology along with lot of symptoms, tubercular miasms, ars iodide, tuberculinum, you have ample pathologies along with the functional symptoms. Phosphorus, purely tubercular miasm, again lot of pathologies with lot of symptoms. So you must be able to understand the miasm on the basis of this, if you are able to understand the concepts very clearly. So this is what he wants to explain over there. Robert's philosophy gives you thorough concepts about all those things. Then he explains, syphilis alone has few cravings in the way of food. Underline, this is very important. There are not so many cravings like Sora. It is averse to meats. There is absolutely no desire for meats. In fact, aversion to meats in syphilitic miasm. But aside from that negative symptom, there is little that we note in the way of appetite. Compare that state. Compare that state with tubercular craving, which were pointed out in the last chapter. In tubercular miasm, there is a craving for meat. See, because Sora dominates over syphilis. In syphilis, it is purely aversion to the meat. Here you get in tubercular miasm the craving for the meat. So you have to understand this on the basis of which you can understand the miasm. The frequent unsatisfied hunger, the craving for meat and potatoes when nothing else will satisfy, The craving for salt, craving for indigestible things, the inability to assimilate much starch, these marked symptoms of appetite shows the psoric parentage of tubercular diathesis. So tubercular, so see earlier paragraph he has mentioned the syphilitic feature, aversion to meat, very less craving. In tubercular it is opposite because it is a mixed miasm, Psora plus syphilis, and Psora dominates over syphilis. That's why you have again lot of cravings, cravings for potatoes, cravings for meat. There is a specifically indigestible things like eating mud, then pencils, which we call by the name of pica, undigestible or indigestible things, lot of appetite, but even losing flesh while eating well, that is a tubercular miasm. So everywhere he tried to compare the miasm in this chapter, the what is Psora, what is syphilis, and what is Psoro-Syphilitic. And this generally, whenever the tubercular miasm is there, Psora dominates over syphilis, and that's why you have ample symptoms of syphilis, ample symptoms of Psora in tubercular miasm. We'll finish one more paragraph. In the syphilitic psoric type, means tubercular type, we find the changes in the chest wall, which are structural changes in bony contours. The chest wall is narrow and may be more shallow than the normal. What is narrow chested? Many people doesn't understand the narrow chested. It is the big thoracic span and very less abdominal span. It is like a barrel, a straight barrel, where the thoracic part is very big and abdominal part is very small. This is narrow chestedness, which you are going to get over there. So chest wall is narrow, may be more shallow than the normal. Even the action of the diaphragm is limited. So the patient breathes very superficially. There is no deep breathing. While there may be no structural changes in the lung itself, there is less air capacity and less residual air in the lung. See, very, very clear about the anatomy and physiology, Robert. Very clear man. The very structural changes eventually bring about occlusion of air cells and the formation of foci. And for these people are very poor breathers. The pumping power is so cramped that they are incapable of supplying sufficient oxygen for the body needs. So their breath is very shallow, superficial, and that's why many times they suffer from insufficiency of oxygen. If you check their oxygen capacity, you'll find that there is it around 80 to 90%. It is not more than 90 many times. This is shown in the anemic and chlorotic conditions as well as in tubercular. Anemia is again one more feature which you can get in this specific miasm, and then if it is tubercular, definitely you have this specific feature. The tuberculosis produces its destruction by first cramping the aeration of the RBC through the formation of bony structure. So problem lies at the bony structure, the RBC production is hampered, and that's why anemia is there with tubercular miasm. This is again a feature of psychotic miasm. Because of breathing is difficult process, they become averse to fresh air and will survive for a long time in a close breath over atmosphere. So these peoples, they generally remains in that they gets accustomed to the less oxygenation, and that's why they can survive even in a closed room. There is no desire for open air which you can get in psoric patient. Psoric always desires an open air. They always wants open place to breathe more because their breathing is very deep, and that's why they craves the open air. Here, the breath is so superficial in tubercular. That's why even though you close them in a room, it doesn't matter for them. So see, here in this specific chapter, Robert tries to compare the miasms and compare the miasms at the cellular level, at the tissue level, so that you can very easily differentiate the miasm and you can think about the right remedy. Understanding the miasm is very important for us in order to reach to the right remedy, and because of which you can get very good results in our patient. So we'll stop over here on this note, and tomorrow we'll meet with the next paragraph. We'll learn again and will not take a break. Today we'll have this lecture only. Tomorrow, much more possibility that we can start Materia Medica session again. So thank you being there, and we'll meet again tomorrow. Good evening.
Thank you very much, sir.